Cool. Hi, good day. My name is Maurice Brown, and I'm a year 5 medical student attempting the obstetrics examination as part of the antenatal care. So we have our patient. So first you have to introduce yourself. So you say, hi, good day. My name is Maurice. I'm a year 5 medical student. I'm here to examine your abdomen and your baby. It will involve me touching your feet, your hands, your face, and gently pressing on your abdomen. It should be uncomfortable but not painful. So can I get your name and age? So here we have this pillow, a 26-year-old. She's resting comfortably. Before I start, I would like to have adequate exposure where she should be undressed down to her underwear, and we should have her stomach exposed up to the pubic symphysis. Okay, so I will start with general observation where I observe this pillow, a 26-year-old resting comfortably. She does have abdominal distension in the posterior and anterior direction. She doesn't seem to have much striatum gravitum. And there's a hypopigmented line, which is the linea nigra. Her umbilicus seems to be non-inverted. Okay, so I check for pedal edema, I check her blood pressure, I check for the pulse, for rate and character, and volume. I check her face for mucous membrane for any signs of anemic, clinical anemia. Okay, so I will start. So the first thing we'll do, I'll tell the patient I'm going to press down gently to check for the fundal height. So first you start at the xiphoid joint and you palpate gently down until you meet the first point of resistance, which is right here. So you take your measuring tape at this point, and then you measure here to the pubic symphysis, which is the bony prominence just above the pubic line, pubic hairline. So this one is about 34 centimeters. So I'm going to tell the patient now, I'm going to examine your stomach. You may be uncomfortable, but let me know if you're in any pain. So while looking at the patient, I do the Leopold's maneuver. The first stage is adjusting or feeling for the fundus of the uterus, where you palpate gently and you feel for any masses. You feel for one large mass, which should be the head, or you feel for separate masses. So in this patient, there's no head palpating. Then you go lateral. You keep one hand on the right and one hand on the left, and then you gently palpate, feeling for a smooth, solid, elongated mass, which should be the back of the fetus. So the fetus is actually located here on the left, while on the right, it's not smooth as you can feel the actual limbs. Alright, so then you tell the patient, so the third stage, which is the Paulick's grip, you feel just above the pubic symphysis and you try to palpate the fetal head. This is uncomfortable, so again, watching the patient, you feel for it, and this would tell you the actual lie and the position of the fetus in the pelvic ring. So the fetal, you can actually palpate the fetal head. So right now the fetal is in a cephalic motion. So the fourth stage of the Leopold is facing the patient's feet, and you palpate within the pelvic rim, and you try to feel for the occipital or the brow, which will present the attitude of the patient. So we are finished. So what we'll do now, we'll do a fluid trial, which is assess the amniotic, or if there's any fluid in the abdomen. So give it a tap, it's not present. And from there we'll auscultate using a Doppler ultrasound, which is best heard on the back, which will be on the left side, just below the umbilicus, where the fetal shoulder will be. And the beat should be 110 to 160 beats per minute. And then you thank the patient, thank him this pillow, that's all, and then you come out. So, and that's it for the exam. So we will summarize. We have Miss Pillow, a 26-year-old, resting comfortably, no abdominal distension, no signs of distress. She has striatum gravidum, a linea nigra, a pulse, and no signs of clinical anemia. The fetal length is 34 centimeters, and the fetal is lying in a cephalic position, where the head is at the release station -3, and that's it. Thank you.